this study that my RAND colleagues and I conducted about mental health before and during the COVID-19 pandemic, we found that about 10% of the US adult population experienced clinically significant distress in the early months of the pandemic in the United States. We also found that there was a strong relationship between a person's mental health prior to the COVID pandemic and the extent to which they experienced distress during the COVID-19 pandemic. This study can help us understand how to respond to the pandemic and how to respond to future disasters by informing us about who in the population is most likely to be affected. One of the things we found was that people in the lower half of the income distribution were more likely to experience increases in distress during the pandemic relative to where they were a year before. We think this is a strong indication that people's vulnerability is impacted by their socioeconomic position and the way that the pandemic has affected them economically and perhaps differentially exposed them to financial hardship and other stressors.